Cancer, in general, refers to the rapid, uncontrolled, and abnormal division of body cells. Once a normal cell turns cancerous, it loses its ability to respect boundaries and stops responding to the control signals from surrounding cells. As these cancerous cells keep dividing uncontrollably, they form a lump or mass of cells known as a tumor. Types of tumors. There are two main types of tumors. 1. Benign tumors. These are non-cancerous tumors that remain confined to a single area and generally do not spread to other parts of the body. 2. Malignant tumors. These are cancerous tumors that can invade nearby tissues and spread throughout the body via the bloodstream or lymphatic system. This process of spreading is called metastasis. Metastasis makes cancer much harder to treat because it allows cancer cells to reach and grow in different parts of the body. For example, someone with malignant colon cancer may also develop cancer in the bone marrow, lungs, or other organs, due to the interconnected nature of the circulatory system and also the lymphatic system. Benign tumors are usually easier to treat as they do not spread, whereas malignant tumors are more dangerous and require aggressive treatment. Introduction to heart cancer. Now, let's focus on our main topic, heart cancer. Heart cancer refers to tumors that begin in the heart's tissues. It is extremely rare, primarily because heart muscle cells, also known as cardiomyocytes, divide very slowly, or sometimes not at all. This low cell turnover significantly reduces the risk of mutations that could lead to cancer. To put this rarity into perspective, heart cancer occurs in fewer than 2 out of every 100,000 people. Why is heart cancer so rare? There are several key reasons why cancer of the heart is such an uncommon condition. 1. Low cell division. Heart cells rarely divide, reducing the chances of mutations that lead to cancer. 2. Constant movement. The heart is always beating and in motion, making it difficult for tumors to anchor and grow. 3. High blood flow. The heart has a rich and powerful blood supply that may help flush away potentially cancerous or mutated cells before they settle. Types of heart cancer. Similar to other cancers, heart cancers can be categorized into 2 types. 1. Primary heart cancer. This originates within the heart itself. 2. Secondary heart cancer. This begins in another part of the body and spreads to the heart. Let's explore these in more detail. 1. Primary heart cancer. These tumors originate directly within the tissues of the heart. They may develop in the heart muscle, the valves, or the surrounding tissue like the pericardium, which is the outer covering of the heart. Common types of primary heart cancers include angiosarcoma. The most common type of primary heart cancer. It develops in the cells lining the blood vessels, usually in the right atrium of the heart. Rhabdomyosarcoma. A cancer arising from the heart muscle itself. It is more commonly seen in children. Pericardial mesothelioma. This affects the pericardium, the membrane surrounding the heart. Other rare types include fibrosarcoma, leiomyosarcoma, lymphomas in some rare cases. 2. Secondary heart cancer. This type of cancer doesn't start in the heart. Instead, it spreads or metastasizes to the heart from other organs such as the lungs, breasts, kidneys, or skin. E.g., melanoma. Cancer cells can reach the heart through the bloodstream or the lymphatic system. Secondary heart cancer is more common than primary heart cancer. These tumors can affect various parts of the heart, including the heart muscle, the pericardium, the valves and chambers. Symptoms of heart cancer. The symptoms of heart cancer often resemble those of other, more common heart conditions, making diagnosis quite challenging. Common symptoms include 1. Chest pain or discomfort. 2. Shortness of breath, especially during physical activity. 3. Extreme fatigue or sudden fainting. 4. Swelling in the abdomen or legs. 5. Irregular heartbeat or arrhythmias. 6. Fever, unexplained weight loss, or general weakness. These symptoms are not specific to heart cancer and can occur in many other diseases, which is why early and accurate diagnosis is crucial. How is heart cancer diagnosed? To confirm heart cancer and assess its extent, doctors rely on a variety of imaging and diagnostic tools, including 1. MRI or magnetic resonance imaging and CT or computed tomography scans. These provide detailed images of the heart structure and any abnormal masses. 2. PET or positron emission tomography scan. Used to detect whether the cancer has spread metastasis. 3. Echocardiogram or Echo 2D. A non-invasive ultrasound of the heart, useful for initial detection of tumors. 4. Biopsy. A sample of the suspected tumor may be taken for analysis, although this is done cautiously due to the risks involved with heart procedures. Treatment options for heart cancer. Treating heart cancer can be challenging due to the sensitive nature of the organ. Here are the main treatment approaches. 1. Surgery. The most effective option, especially for benign tumors. If the tumor is accessible and has not spread, surgical removal can offer the best outcome. 2. Chemotherapy. Often used in cases of malignant tumors, but may have limited effectiveness for heart cancer. 3. Radiation therapy. Used in select cases, though it carries risks due to the potential damage to healthy heart tissue. 4. Heart transplant. A rare and last resort option, typically considered when the tumor is inoperable and life-threatening. Prognosis, the outcome. Benign heart tumors, when removed successfully through surgery, generally have a good prognosis. Malignant heart tumors, however, are aggressive and often diagnosed late. The average survival time after diagnosis is usually around 6 to 12 months, depending on the type and stage of cancer. Awareness and prevention. There are no guaranteed ways to prevent heart cancer, but you can reduce your overall cancer risk and support heart health by avoiding unnecessary radiation exposure, eating a heart-healthy diet, exercising regularly, not ignoring early signs of heart problems, visiting a doctor for regular checkups and when unusual symptoms occur. Final words. Heart cancer is extremely rare but very serious. Due to its aggressive nature and similarity to other heart conditions, it is often misdiagnosed or detected too late. That's why awareness, timely investigation, and early detection are key to improving outcomes. While most people will never encounter heart cancer in their lifetime, understanding it helps us stay informed and better prepared. Thank you so much for investing your valuable time.